Hello everyone, my name is Sean Nybarger, and for my special considerations project, I wanted to look into the effect of exercise on mental illness. So mental illness is a very broad field and cannot really be defined in a single way, and this makes it very similar to physical illness. Mental illness is comprised of conditions which affect a person's way of thinking, their emotions, and also behavior. Currently, there are over 300 mental disorders that are diagnosable, and the main groups include anxiety disorders, personality disorders, psychotic disorders such as schizophrenia, eating disorders, trauma related disorders, and also substance use disorders. And although all are very serious, mental illness can range from mild cases seen in mood disorders and also very intense, serious cases of psychosis, which can be observed in people with schizophrenia, for example. This leads us into the discussion of what mental health is, and this is a person's emotional, psychological, and social well being. Mental health also affects how a person thinks, feels, and acts. It determines how well one can handle stress, relate to others, and handle decision making. Mental health can be strong or weak, and weak mental health does not necessarily indicate the presence of mental illness. And similarly, a person with mental illness can also experience periods of physical, mental, and social well being. The importance of mental health has been coming up more and more often throughout the health field, as mental and physical health have been found to go hand in hand as one affects the other. Poor physical health can often lead to poor mental health, and likewise, poor mental health often leads to the onset of physical health problems. For example, depression is associated with a 40% higher risk of cardiovascular and metabolic diseases. Someone with high stress is more likely to die from cancer, and schizophrenia is associated with double the risk of death caused by heart disease and 3 times the risk of death caused by respiratory diseases. These are often due to the separation in healthcare. Physicians are not treating the whole person, but rather isolating mental health from physical health. People with mental health conditions are less likely to receive proper physical health care, and additionally, the population is less likely to receive the help to cease smoking, reduce alcohol use, and construct a proper nutrition plan, which goes into the overall health of a person. Just within the United States, 1 out of every 5 adults experiences mental illness every year. 1/6 of the youth experience mental health disorder each year, and suicide is the second leading cause of death among people aged 10 to 34, and the 10th leading cause of death overall across all Americans. And 90% of people who commit suicide had shown symptoms of mental illness. Additionally, 43.3% of adults with mental illness received treatment in 2018, and 50.6% of the 6 to 17-year-olds with a mental health disorder received treatment in 2016. So there are a considerable amount of risk factors which go into the development and maintenance of mental illness. The non-modifiable risk factors include early traumatic experiences such as abuse, trauma, sexual assault, and violence, biological predispositions such as genetics being passed down through the family, and chemical imbalances, which, for example, would be serotonin, which is related to anxiety and depression. The more modifiable risk factors would be substance use. Substance use is attributed to substance use disorders, as well as it's known to worsen underlying mental illness which are already present. The isolation and lack of support of a person can prevent them from forming relationships, which are known to allow people to feel connected and increase a sense of purpose and well being. And third would be the chronic medical conditions. And this is more or less a modifiable risk factor, but we can prevent this from being the case through proper nutrition, proper exercise, preventing people from um, forming the most common illnesses due to the sedentary lifestyle and poor nutrition, which is seen so common in America. There's currently a wide variety of treatment options for mental illness. Below are included a group of the most popular currently being administered by professionals. Of these would be medication, which is not designed to cure mental illness but to relieve its symptoms. It can improve effectiveness when combined with other treatment methods such as psychotherapy. Psychotherapy itself would be the discussion of thoughts and feelings with a professional, which allow a patient to gain understanding of their condition, as well as gain coping mechanisms and skills for management. Furthermore, there would be Brain stimulation treatments, which are usually only administered after medication and therapy have already been tried. These include electroconvulsive therapy, repetitive transcranial magnetic stimulation, deep brain stimulation, and vagus nerve stimulation. There's also residential treatment programs. These are usually for more serious conditions, people who are at risk of harming themselves and who are unable to take care of themselves. This kind of treatment provides a supportive place for them to reside temporarily. And finally, there's substance misuse treatment. Substance abuse usually coincides with mental illness and can worsen it in many cases, and this treatment option acts to cease substance use in order to be able to treat the underlying mental illness at hand. In addition to professional treatments, there's also modifiable lifestyle factors, which, when improved, have been shown to reduce chronic disease, promote social connectedness, as well as a sense of well being. Of these would be exercise, which is associated with increased release levels of hormones and neurotransmitters, creating an increased level of alertness, mood, and positivity. There's also diet. Eating a well balanced diet has been shown to prevent the development and help the management of depression and Alzheimer's. Additionally, poor nutrition is associated with poor immunity as well as an increased sensitivity to mental health disorders. There's also substance use, and this creates a negative effect on mental and physical health. For example, smoking products with nicotine temporarily increase dopamine levels, but long term reduce the body's natural method of releasing the neurotransmitter. And this causes a decrease in positive feelings associated with the dopamine and also increase a reliance on nicotine. This can create both long term physical and mental complications. The modifiable lifestyle factor I wanted to focus on associated with mental health was obviously exercise. So, exercise has been shown to reduce the risk of chronic diseases, which are often associated with depression. And these include heart and lung disease, high blood pressure, diabetes, obesity, cancer, dementia, Alzheimer's, as well as Parkinson's disease. Exercise helps to increase the level of fitness in a person, which inherently helps to increase their self esteem. Exercise releases endorphins and serotonin, which are associated with improved mood, also reducing symptoms of many illnesses associated with chemical imbalances. Exercise helps to reduce feelings of isolation as well as stress, and it also increases alertness. When you exercise, more blood is being pumped to the brain, which allows it to protect itself from injury as well as the onset of disease. And finally, exercise helps to increase the size of the hippocampus, which is responsible for memory. A research article titled Exercise and Mental Health revealed that the main group of mental illnesses found to be improved by exercise included anxiety, depression, panic disorder, schizophrenia, mood disorder, and PTSD. This article also revealed that there is not a huge difference between aerobic and anaerobic exercise, as one study showed that there was an improvement in mood as well as a reduction in symptoms of anxiety for hours after a 20 to 40 minute aerobic exercise. There's also a study showing schizophrenic anxiety as well as subjective well being symptoms were improved after a single bout of exercise. This article went on to address the hypothesized methods through which exercise affects mental health. The first of which would be endorphins. Exercise increases endorphins with mild to vigorous intensities, which has been shown to decrease depressive mood. Next is its effect on the mitochondria. Neuroplasticity is necessary for an efficient nervous system, and in order to have good neuroplasticity, the neurons need to have sufficient mitochondria to provide about 4.7 billion ATP per second. Neurons need this large amount of ATP as they undergo an immense amount of stress signals, and exercise has been shown to have a correlation to mitochondriogenesis, which inherently enhances neuroplasticity through this process. Next is the neurotransmitters themselves. Exercise increases the levels of adrenergic and serotonin neurotransmitter levels, which has a similar effect of the pharmaceutical selective serotonin reuptake inhibitor, and this takes the largest effect on untrained individuals. Lastly is exercise effect on inflammation. Inflammation is a major contributor to chronic disease and a leading cause of death. It has been linked to depression and poor mental health, revealing a strong connection between the nervous and immune systems. Exercise has been shown to reduce inflammatory diseases such as Alzheimer's and chronic obstructive pulmonary disease. Exercise increases cytokines as well, which create a anti-inflammatory environment, improving the neuroimmunological system. And furthermore, exercise decreases vagal tone, reducing systematic inflammation in the digestive tract. Another article titled "The Effects of Exercise on Mental Health" provided a few more benefits of exercise, including reduced feeling of distress, enhanced overall psychological well-being, the delayed progression of dementia, as well as the delay and decline of cognition, which is associated with aging. Although this article was published in 2010, it touched on the fact that there was a lack of research in this area. So it's important moving forward as scientists and health professionals that more research be conducted in this field in order to find the best and most effective way to treat mental illness as it is being seen more and more often in America. Here's the list of sources which I used to gather most of the information included in this project, as well as the research studies I examined and the images included in the slides. I would just like to thank everybody for their time and attention. This was a project that I had a lot of fun researching, as it's a very important topic in today's society. I will also be attaching a test question which is related to the information talked about in this study. So just thank you everybody, and stay home and stay safe.